Thank you very much for the introduction. It's a great pleasure to me to be in this beautiful country to speak a little bit about my experience. As said, my name is Leonardo Marquez. I'm a radiologist in northern Germany, in Flensburg. You can see probably from my name that I'm not original from Germany. I'm actually born in Brazil. But you probably don't want to hear me talk in Spanish. That's why I'm doing this presentation in English. And I'll be talking about drug-eluting balloons and what happened after KATSANOS published his research. That's my disclosure. Sorry? Oh, should I press something right here? Oh, there he goes. So, and as you probably all know, 2018, KATSANOS and his colleagues in Greece published a meta-analysis on the increased risk of mortality after 5 years of use of paclitaxel in patients in FEMPOP treatment. Up to this time, we were all used to treat our patients with DCBs, DEBs, and DES. So it was a real shock because this treatment was well established. We use in almost every patient up to this day. It was a very efficient treatment. So what was the reaction after this meta-analysis was published? The first reaction came from the government agencies, the FDA, and also the agencies in Europe, and probably also here in Latin America. They conducted panels and meetings and published letters of recommendations for the physicians and healthcare providers. So how to cope with this information. So as probably also happened to you here in Colombia, it was from night to day, there was almost a complete stop in the use of DCBs and other therapies with paclitaxel. And of course, it triggered the search for more clinical data and analysis from these patients. It was also a huge hot topic in the congresses that followed. So I have here also a timeline with some of the facts that happened in the years after the publication of this study. So you have December 2018, you have the publication, and you also have a few weeks later, the letters from FDA and other agencies that introduce this topic and also discuss it further. So you also have beginning in early 2020 the first follow-up studies, the first studies that followed this meta-analysis from other agencies and for healthcare providers, and also industry was also there. So we have here a whole year, 2020-2021, there was a lot of going on. As you can see here, that's KATSANOS, it's marked with red around, but every other data that we analyzed, that we gathered after this day, showed no sign of increased mortality. So this is also a table where we can see more of the data that was gathered. So we have KATSANOS and the first meta-analysis from industry-triggered RCTs that followed. After that, we had a risk ratio or a hazard ratio above 1. That means that paclitaxel was somewhat involved in a high risk for mortality. But you also have here with increased numbers of analysis of data that with up to hundreds of thousands of patients that show no increased risk in the mortality. So you also have here studies from the US, for the Medicare in US with 168,000 patients, and you also have German healthcare providers and insurers that also with lots of patients that show no increased risk and actually a decreased risk for mortality in these patients that become therapy with paclitaxel. So the question then remains, after we have all this data, were there any benefits from this meta-analysis? And of course, you can say yes. It started a huge debate on how we discuss our data and how we treat our data and how we analyze it, and it further brought us the information we need when treating with paclitaxel. We have a lot of data on long-term use of paclitaxel, and sorry. So there's a multitude of new clinical data from RCTs, from independent studies, and from databases from healthcare providers and healthcare insurers from many countries in the world. This proves the initially found mortality signal from KATSANOS meta-analysis. So we are expecting in the time to come, nearly in the near future, that the recommendations from the agencies we updated for the use of DEBs with the positive signal from paclitaxel. So using this hook, I'd like to go to the next part of this session. What is the concept of DEBs after all? What is a DEB? How does it work? And what is also the portfolio from Eurocore DEB's clinical program? So what are the advantages of DEBs? It's of course a very good treatment, proven treatment option for the coronary vessels, bifurcation lesions, and in-stent restenosis, where stenting is not the recommended option in these patients. It leaves all future treatment open and allows for re-intervention. So it goes from the premise of leaving no matter behind. There is of course no risk of stent fracture, movement, or delayed healing from these patients. The needed amount of the antiproliferative drug, the paclitaxel in this case, to avoid the early restenosis, is directly transferred to the vessel's wall by a single balloon inflation. And most of all, very important here, the modern coating technology allows a well and safe transfer of this drug to the vessel's wall. So that's very important to know that the different coatings that are involved provides different results and also reduce or increase the risk of washing out this drug and going in the bloodstream. The active drug is for the Eurocore balloons is paclitaxel, and most of our recent studies show that paclitaxel is of course the best drug to treat the patients. You also have sirolimus, everolimus, and other drugs, but paclitaxel is I would say the best of the drugs because it is proved to have a better transmission in the vessel's wall, so it infiltrates better in the vessel's walls than the other drugs. Usual concentration from the drug on these balloons is between 2 and 3.5 microgram per square millimeter, and the crucial point for the safety of this balloons is the coating technology. So you have coatings that could be amorphous coating, crystalline, or a sort of hybrid coating. So with the older generation of crystalline coatings, you have a surface that's covered with a white powder. You can see it, you can feel it, it stick to your gloves when you're handling it. If you can see here in this optical image, it's a crystalline hydrophilic coating. Hydrophilic means that when you put to the sheath and it comes in contact with the blood, it's gonna start to release this drug, so you have to be quick when pushing the balloon through the vessel, and also would mean more washout downstream. When you look at the coating, it's like a crystalline sugar, powder-like. It has a matrix with a rigid crystal shape, and with this rigid crystalline shape, you have coating. You also have so affected by the mechanical distress. So when you push through the sheath, you have this mechanical, you have this kinking, you have this bending of the balloon, and it introduces cracks in the coating, and also helps to release this. Also helps, but it distresses and releases the drug prematurely in the blood current. With the newer generation of amorphous coating, you have a smooth transport surface on the balloons. The amorphous coating is also lipophilic, so you don't have this problem with when in contact with the blood that the drug will dissolve and run downstream. When you look at the coating, it's more like honey like look on it. You have a non-crystalline PTX, paclitaxel, melted within the polymeric excipient, and being elastic, it means it won't suffer from the mechanical distress. So bending and passing through the sheet and to the lesions won't cause the drug to be released on a blood flow. So there is another picture from the amorphous coating and from the crystalline coating. So on the left side you can see the crystalline coating with lots of edges and spikes, and you can imagine that it's gonna hang somewhere in the vessel's wall, in the sheath, in the gloves, everywhere. And with the amorphous coating, for instance, from the freeway balloon, you see that's a very smooth surface with very little place to hang around on the vessel's walls. And you can see from this picture also it was made a cut here to show the many layers of paclitaxel and the amorphous coating. So with the Eurocore freeway balloon, the paclitaxel is not lost on the way to the lesion. As I said, there's a lower risk of downstream shower of these particles, and the shellac where the paclitaxel is embedded allows a better transition to the artery wall. So that's why I'd like to talk on this slide. Also, you can see here how the paclitaxel is on layers within the shellac brought on over the balloon. Thank you. And when inside the vessel, when in contact with the blood, this shellac will absorb some of the water from the blood and then will swell, but will still retain the paclitaxel within it. So when you inflate the balloon, this sponge-like, it's going to be pressed against the wall, and then it's going to release the drug. So you don't have spikes to adhere to the wall, you just have this sponge pushing the drug inside the vessel's wall on this amorphous coating. And that's where if you want your best results for that, you have to treat your lesion well, you have to pre-dilate your lesion, you have to give time also for the paclitaxel to do its wonder, to infiltrate the vessel's wall. So pre-dilate your lesion with your ordinary balloon, and give time for the paclitaxel to infiltrate the lesion to the vessel's wall. That's a main tip here for the treatment of DEBs. So with the amorphous coating, with the freeway on the Nadir balloons, you can see here from this slide that's very, very low flush downstream from this drug. You can see here it's not up to scale. This chart here, you have 5,400 nanograms per milliliter as a toxic level for the paclitaxel. If it was on scale, the chart, you wouldn't even see these candles here. So it's very low washout of the drug inside the vessel and within the serum concentration. So what is then the drug-eluting balloon program from Eurocore? So all the balloons were designed and are built and sterilized in Germany, and they have the coronary and the peripheral programs. With the coronary, you have the second generation of the Dior balloon, and for the peripheral vessels, you have for below the knee the freeway 014. For FEMPOP, you have freeway 0435. And for the shunts, you have the high pressure DEB from Eurocore freeway. So for the PTCA balloon, the Dior, it's again the DEB with the latest generation of this coating for the amorphous coating. the clinical safety and efficacy data from a broad clinical program with hundreds, thousands of patients and over 20 publications. The balloon comes in diameters from 2 to 4 millimeter, lengths from 15 to 30 millimeters, and shaft lengths of 140 centimeters. As for the indications for the DEER balloon, you have coronary lesions ranging also from 2 to 4 millimeter. It's very good on the treatment of in-stent restenosis and small vessels. And here you have an overview on the large clinical program for this balloon with more than 1,000 of patients and more than 20 publications. Some of these publications with the help of Colombian physicians. For the periphery, you have then the freeway O35 balloon, for instance, and the freeway comes on a diameter from 4 to 88 millimeter for lengths of 20 to 230, so you can manage with one balloon small lesions, but also longer lesions with just one balloon. And you have shafts of 80 or 135 centimeter for your comfort. For the AV shunt balloon, you have a high DEB balloon that also on the range of 4 to 8 millimeters in diameter, but you also have the lengths of 20 to 60 millimeter. You don't have need to those longer balloons. And also for the comfort, you have the 40 centimeter shaft lengths. All of these balloons, they come with the amorphous paclitax cell coating of 3 microgram per square millimeters from AeroCore. What is then the clinical evidence for the freeway balloon? We have the PACUBA trial, and we have the free weight stent study. Being the free weight stent study, one of the studies from AeroCore that our hospital took part of. I myself made the intervention, performed the intervention for some of these patients of the freeway stent trial. And also the long-term data for the freeway stent is also available. And for the AV shunt, you have a series of registries that show the results of this balloon. So for the PACUBA trial, you have one single center in Austria with 74 patients where they analyzed the freeway against standard PTA. And for the larger freeway stent study, you have 13 centers in Germany and Austria with 204 patients where a 19-0 stent was implanted, and after that it was either dilated, post-dilated with the freeway or a standard PTA. So in summary for this first part, you have new independent data for real-world evidence also for the safety of the paclitaxel. That's very important because no other large data studies showed any sign of increased mortality for these patients. Very importantly also, the freeway DEB specific long-term data shows no mortality signal at 5 years intervention, but that will be a topic for my second presentation. And most important, this coating of the paclitaxel from the AeroCore amorphous coating is very safe, and the drug is not lost on the way to the lesion, as you probably can analyze from the crystalline coatings. Thanks for the attention.